actually been diabetics and hypertensives in terms of fatalities. And so it's still the issue of comorbid conditions. You have raised, Graham and Gina have raised two important questions on cross-infection when it comes to facilities. In particular, what we've seen in terms of Shalom Hospital. And yes, the DG has released guidelines in terms of how healthcare facilities can ensure that we're preventing cross-infection, all the way from the entrance of the hospital, a triage mechanism that ensures patients are triaged, those who may be presenting with symptoms of cough, any COVID-like symptoms with fever, they're actually filtered in one pathway and disaggregated from other patients. Indeed, what we are noticing is that in this particular case, there was cross-infection, and our teams are currently on the ground as we speak, teams from the Ministry of Health collaborating with county government teams to ensure that measures are put in place. And of course, as it stands right now, we have actually curtailed any further admissions to Shalom Hospital as we assess the situation, as tests are conducted for the current inpatients who are there. We have about 122 who are admitted there, and so there's a process ongoing, and Dr. Kuria will elaborate on what this approach will look like. And of course, this is a situation that will come about if all hospitals, whether public or private, do not put in place proper measures of IPC. And some of these measures include simple measures for the healthcare workers as they move from one patient to another, measures in terms of the sanitation facilities for the patients, measures when it comes to the ventilation in the rooms, in the wards where the patients are, and of course also ensuring that there's that high index of suspicion by the healthcare worker as they deal with the patients. With regards to testing and our strategy when it comes to testing, Dr. Kuria will share more information, but it is important to know that it might not be that all patients walking into a health facility would be tested. Remember, when we've looked at the disease and tried to understand this new disease, it's a disease that, you could be tested today and that you're negative, but then tomorrow you happen to be positive. And so it calls for a very rational approach when it comes to rolling out a testing strategy. The other key issue, in terms of how we see this going forward is that the Medical Council, which is actually tasked with ensuring that health facilities are adhering to these measures, will scale up its efforts in terms of ensuring, one, there's that inspection to ensure facilities are actually adhering to these IPC measures, and two, to also determine what does it mean for your private facility to actually be able to handle a positive COVID case. What are the measures you should undertake as a private provider in terms of undertaking to ensure that you can actually, manage these COVID-19 cases? And so perhaps I'd ask Dr. Kuria to add in more information on this with regards to the testing strategy and how we see this going forward when it comes to IPC.
Thank you, Mr. Ngangi. The issue of Shalom and what has happened to Shalom, whether it's going to happen to every other health facility, let me reiterate here that Shalom Hospital is not closed. Shalom is still operational. It still has 125 patients in there. In fact, there is one we are following up closely. And we are doing testing of the staff that are there just to know the extent of the disease within the facility. Treatment is ongoing, but they are not taking in any other inpatients or outpatients until they establish what is happening. So it has not been converted into a quarantine facility, as you may have suggested. But for now, those who are in there are quarantined, just as the word quarantine means, until we establish that they have no infection. The healthcare workers who are there, we are trying to ensure that they are rotated because they cannot continue working. And we are working on a modality where fresh group of staff can go in with the proper fitting of PPE, and we have made sure that the adequate PPE has been available at the hospital. So they will be rotated, and those who are in will be moved into safe quarantine, either at home based on the assessment of the home background that is being done currently, or in a facility, and we are in discussion with the hospital management to see how best we are going to quarantine the healthcare workers in that facility. So it will not happen to any